We also have to think about the potential relationship between muscle development, gait, and stability of the limb. We can see that this horse, when walking, does not load the metatarsal region in a vertical position. As a result, as the horse progresses, the heel will rotate laterally and the hock will oscillate laterally. This is generally a reflection of inadequate function of the hamstring musculature and can be greatly improved by specific exercises which engage the hamstring muscles. This lack of stability of the hind limbs is biomechanically inappropriate and potentially can predispose to other injuries. When looking at the symmetry of the pelvis, it is vitally important that the horse is standing squarely on a horizontal level surface. We need to not only appreciate the presence or absence of muscle symmetry, but also consider the osseous components of the pelvis. And we need to differentiate between osseous asymmetry and muscle asymmetry. In this horse, if we look at the top line, the top yellow line, we can see clearly that the right hindquarter is less well muscled than the left, and the right tubercoxy is lower than the left. The second large yellow line reflects the level of the left tubercoxy, and the bottom right arrowhead reflects the position of the right tubercoxy. So here we have asymmetry of the osseous components of the pelvis in addition to muscle asymmetry. We can also see, highlighted by the blue arrows, that the biceps femoris muscle is also less well developed on the right side compared with the left. This horse has profound atrophy of the quadriceps femoris, biceps femoris, and tensor fasciae latae muscles. This was determined to be neurogenic in origin. The horse is a European-based show jumper that had never been to North America, so this was highly unlikely to be related to equine protozoal myelitis, although this would have to be an important differential diagnosis in the United States. We need to have some knowledge of functional anatomy, and I'm not expecting you to know this, but you need to know where to look it up. The quadriceps femoris muscle is innervated by the femoral nerve, which is derived from the lumbar 4th, 5th, and 6th nerve roots. Tensor fasciae latae is innervated by the cranial gluteal nerve, derived from the 5th and 6th lumbar and 1st sacral nerve roots. And biceps femoris is innervated by the caudal gluteal nerve, derived from the sacral roots of the lumbosacral trunk. And here we can see the femoral nerve, D, the cranial gluteal nerve, F, and the caudal gluteal nerve, N. Let's now consider some aspects of forelimb conformation. In the horse on the left, if we look at the top and the bottom yellow arrowheads, we can see that the horse has a base narrow conformation. The distance between the front feet is considerably smaller than the distance between the proximal aspect of the antebrachial regions. And as a result of this, if we drop a perpendicular line from the right shoulder to the ground, this line does not bisect the limb and finishes outside the lateral aspect of the hoof capsule of the right forelimb. In the chestnut horse on the middle, we can see that the medial styloid processes of the radius are asymmetrical in height, being higher on the left forelimb compared with the right. This was associated with a taller foot on the left side compared with the right side, so that the coronary bands are not symmetrical in level.